Hello and welcome. Today we're diving into a rare but serious congenital condition affecting the urinary system, urethral atresia. We'll explore what it is, why it happens, how it's diagnosed and managed, and what the future holds for those affected. Urethral atresia occurs during fetal development. While the exact cause remains largely unknown, it's believed to be a result of disruptions in the normal processes of urethral development. Several factors might play a role, including genetic mutations, exposure to certain environmental toxins during pregnancy, and perhaps even deficiencies in specific nutrients during critical periods of fetal growth. However, these are often speculative, and much more research is needed to pinpoint the definitive cause. In a normally developing fetus, the urethra, the tube that carries urine from the bladder to the outside of the body, forms correctly. In urethral atresia, this process is interrupted, resulting in a complete blockage of the urethra. This blockage prevents urine from exiting the bladder. Consequently, urine backs up into the bladder, ureters, the tubes connecting the kidneys to the bladder, and eventually, the kidneys themselves. This backflow, called hydronephrosis, can severely damage the kidneys, leading to renal failure if left untreated. In severe cases, the buildup of amniotic fluid due to impaired fetal urination can also cause oligohydramnios, potentially impacting lung development. Urethral atresia is a very rare condition. Reliable epidemiological data is scarce due to its infrequent occurrence. Estimates suggest it affects a small number of births, perhaps 1 in 20,000 to 1 in 50,000 live births. Because it often presents with other congenital anomalies, its true incidence may be difficult to ascertain. Urethral atresia is typically detected prenatally. During routine prenatal ultrasounds, signs like an enlarged bladder, megacystis, and hydronephrosis may be observed. In severe cases, oligohydramnios, a deficiency of amniotic fluid, might also be present. Postnatally, if the condition was not detected prenatally, the infant may present with an inability to pass urine, abdominal distension, and signs of renal failure, such as lethargy and poor feeding. Diagnosis of urethral atresia usually begins with prenatal ultrasound. Suspicious findings prompt further investigation. After-birth diagnostic imaging, such as voiding cystoarthrogram (VCUJ), can be performed to visualize the urinary tract and confirm the blockage. Genetic testing may be considered if other congenital anomalies are present, aiming to identify any underlying genetic syndromes. While urethral atresia is broadly categorized as complete absence or blockage of the urethra, there aren't strict classifications. However, the severity of the condition and the presence of other associated anomalies can influence the specific treatment approach. The primary goal of treatment is to relieve the urinary obstruction and preserve kidney function. Prenatally, serial amniocentesis may be performed to relieve oligohydramnios, although this is a temporary measure. After birth, surgical intervention is required. This often involves creating a vesicostomy, an opening from the bladder to the abdominal wall, to allow urine to drain externally. More definitive reconstructive surgery to create a functional urethra is usually performed later, when the infant is larger and better able to tolerate the procedure. Long-term management involves monitoring kidney function, addressing any complications like urinary tract infections, and providing ongoing support to the child and family. Currently, there's no known way to directly prevent urethral atresia, given the unknown etiology. However, general recommendations for a healthy pregnancy apply, including taking prenatal vitamins, avoiding exposure to known teratogens, substances that can cause birth defects, and managing any underlying maternal health conditions. The prognosis for infants with urethral atresia depends on several factors, including the severity of the condition, the presence of other congenital anomalies, and the success of surgical interventions. Early diagnosis and prompt treatment significantly improve the outcome. Some individuals may experience chronic kidney disease and require long-term management. Research continues to focus on understanding the genetic and environmental factors involved in urethral development, aiming to develop potential preventive strategies and improve surgical techniques. Additionally, advancements in prenatal imaging and fetal interventions hold promise for earlier detection and management of this challenging condition.